We're going to go ahead and get started. So welcome everybody today to our 17th virtual shadowing session. My name is Nina and I'm the co-founder of Priel Shadowing, and I am very honored to welcome to you today Savanna Perry, who is a PA dermatologist in Georgia. Welcome, Savanna.
All right, thanks for having me and putting this together. I'm very impressed by your organization. So thanks everyone for taking some time out of your day. I think Nina mentioned it is finals time for some of you. So it's coming up quick. So I appreciate y'all taking an hour out to hear about my job. And I'm happy to answer any questions about being a PA, pre-PA stuff, PA school. Anything is fair game. So I'm going to put a presentation up and talk a little bit about my journey to becoming a PA, what my job looks like, and then we'll go through a couple cases of things that I see pretty frequently working in dermatology. If y'all have any questions during the session, go ahead and put them in the chat, and then we'll try to get to as many of those as we can. All right. Okay, so just a little bit of my background. So I'm in Georgia, born and raised. Haven't really ever left Georgia. A lot of my family's from Alabama, but I went to the University of Georgia and I graduated in December of 2011, a little bit early, thanks to some online classes, and I got my degree in biology. I was going into college pre-med field. I didn't know what I wanted to do exactly, but I knew I wanted to do something in healthcare or medicine. So I would say freshman year, I was probably looking most closely at medical school, PA, or nursing. Once I had started taking my classes, I decided I probably didn't want to switch to the nursing path. And so going into kind of after freshman year, sophomore year, I was more pre-PA versus pre-med. I spent a lot of time shadowing that first summer, and I shadowed with actually both a doctor and a PA team. And I would go with both of them separately and together. And that's when I really decided that for me, the PA, both path and profession, made the most sense. So I really was drawn to the teamwork aspect, but in observing that team, the role of the PA. And I've always been somebody who's just like ready to work, and I wanted to get out there and start working. I had felt a lot of anxiety freshman year about testing and the competitiveness of my 300 plus classes. And so I wasn't super excited about the med school route, but once I kind of committed to and decided on PA, I actually got really excited about what I was going to do. So I went back pre-PA, stayed that the whole time. I applied in between my junior and senior year of undergrad with the hopes of going straight in and not taking a gap year, which was possible. So I started right after graduation in May at Augusta University in Georgia. And it was a 27-month program. We went straight through. We had the first half was didactic in the classroom, and then a year of rotations. PAs are trained in a general sense, so kind of as a primary care type role. We only had 2 weeks of dermatology in PA school, but a lot of PAs do end up going into specialties. We just don't have to do formal residencies, and you can switch specialties. So after I graduated, I went straight into dermatology, and that's what I've been doing for the past 6 years. I put a couple of pictures from PA school and from graduation. So my husband, I guess boyfriend, fiance, husband, through undergrad, went to medical school. So while I was going to PA school, he went to medical school, and now he works as a hospitalist. So if anyone has questions about comparing the two routes, we can get into that a little bit too. So my job as a derm PA, it I would say I have a pretty traditional role. There are some derm PAs who only do surgery, or who only do cosmetics, or who don't do any cosmetics or surgery and just do medical cases. I do a little bit of all of it, and I've worked in 2 different practices now. My first practice I was with for 5 years, and I worked full-time there. I now work in a part-time role in a different practice. So I work Mondays and Tuesdays, and I see a whole mix of different things. So medical dermatology is going to be kind of anything you think of that's skin related: acne, eczema, rosacea, psoriasis, warts, molluscum, funny moles, rashes we don't know what they are. Skin can do some crazy things. When I first started shadowing in dermatology, which is what made me interested in it, there was a dermatology PA in Athens, Georgia, who let me come shadow her once a week for about a year. So I would go one afternoon a week and spend time with her. And I honestly thought it was gonna be so boring. I thought there can't be anything that interesting about skin. I'm just gonna be having to look at like naked old people or acne all day and listen to teenagers complain about their face. But it actually turned out to be so interesting. And now I love treating acne patients, and I love, getting to form relationships with all of my patients. So it's a lot. It's not as boring as people think. But so the medical side, I see mainly, with most of my patients, they don't necessarily need a procedure. But if those patients come in and do need a procedure, so if someone comes in and they have a funny spot on their arm, or a cyst or a wart, I'm able to go ahead and treat those things. So we do a lot of biopsies. We do either what's called a shave biopsy, which is where we just kind of take a little scrape off the skin, or we do something called a punch biopsy, where we take like a cookie cutter out of the skin and put a couple stitches in. So lots of biopsies. We use liquid nitrogen to freeze things. If you ever had a wart growing up and you had it frozen, I do that a lot. And then things like cyst, if you've ever watched Dr. Pimple Popper, draining cyst, cutting them out, all that fun stuff too. On the surgical side, which is what I really enjoy, I loved surgery when I was on rotations. I'm able to do excisions. So that's where you would, let's say I do a biopsy on someone's arm, and it comes back as a skin cancer. We'll have to go back and cut around that spot and cut a little deeper to make sure we've cleared the whole thing. So we cut that out, put in some stitches, and make sure it's all gone. So I am able to do the surgeries that I feel comfortable with. And when it comes to a PA, being a PA, your role and your independence and your autonomy is going to look very different depending on what specialty you're in or where you're working. Also, your level of experience and your relationship with your physician. In the office I'm in now, there's one physician and another PA. What we do on a daily basis does look very similar, but if there's ever anything that I don't feel comfortable doing, my physician, I'll usually ask her if she's comfortable doing it. And if not, we'll refer out to either general or plastic surgery or somebody called a Mohs surgeon, who's a specialized dermatology surgeon. So for example, I don't really like to do things on the face. And depending on size, my physician may or may not do it. Same thing with cyst. My kind of cutoff is about 2 centimeters, with what I feel comfortable cutting out, and also depending on where it is. My physician will sometimes do a little bit bigger, like 3 or 4 centimeters, but that's just a personal preference. I personally don't cut out melanomas, but both the physician and PA I work with do cut those out. But the other PA I work with doesn't cut cyst out just because she doesn't prefer doing that. So we share patients a lot. We work together a lot. We talk about patients a lot. And then on a daily basis, we're all interacting, but I'm seeing my patients independently. So on a typical day, I can have up to 35 patients on my schedule. I would say out of those 35, which usually it's not quite that much, especially right now at my new practice, but I would see around 25 to 27 a day. I start at about 8 a.m., go till 11:30. Usually that 11:30 spot is either a surgery or a cosmetic appointment. Start back at 1 and then go until my last patient appointment at 4. So I'm usually home by 5, which is great. I went part-time because I put a picture of my baby in the corner, which she's 2 now. That was a year ago. And I just really wanted to be home more with her. So that's been nice. But having a schedule where I can do everything at work, I don't ever take notes home. I make sure everything's done before I leave. Lets me kind of be more present at home. We see babies, which is fun. And then we see elderly patients. It's a whole range. And then on the cosmetic side, which is kind of fun, we get to do Botox, fillers, chemical peels, lasers, microneedling, everything else. We have some other devices in our office, but having that variety kind of mixes it up a little bit so it doesn't get too boring in the office. But we got to move fast. We see a lot of people, and it's pretty fun. Being the newest PA there, I have the most openings, so I see the weirdest stuff. If somebody calls with a new patient or a rash, typically they're going to be able to get in to see me the quickest. And so they kind of joke that I get to see all the cool cases. And sometimes I even just bring my physician in because I know that she'll be interested in it. Not really because I don't know what's going on or don't know what to do, but because we all like to, something that's a learning opportunity. We all want to get each other involved so that we can share our knowledge. I'm a huge proponent of mission trips. One thing I didn't know before I was actually a PA is that there are specialty specific missions. So I went on a dermatology specific mission to Kenya. And it was a really cool experience because I was able to essentially do what I do here, but in a different country. So if you are interested in missions, there are definitely like general mission trips out there, but you may also be able to use whatever you end up going into in other countries or even other parts of this country. So just something to think about if that's something that you're interested in. And then how y'all found me was I do a website called the PA Platform. So if anyone is interested in becoming a PA, there's tons of information on the website. It's just thepaplatform.com. And then we post a ton on Instagram at the PA Platform's my handle. But if you have questions about PA school, things you need to do for PA school, you can definitely find a lot of information there.
Hi, Savanna. I have a quick question. I see in the chat a lot of students are asking, how did you find mission trips and how do you come across those opportunities?
So missions have always been really important to me. I did some in college that actually weren't medical, and those I did through a campus ministry. I've heard a lot of really good things about, I think it's called Global Med Brigades or something like that. I think that's an organization that's come out since I was in college. And so I think if you can find something local to either where you go to school or where you're from, that's your best bet for kind of getting started with something as far as missions. Once I got into PA school, I found, well, because my husband was in med school, the med school was actually doing a trip to the Dominican Republic. And so I was able to jump on board with that trip. So talking to people in other programs at other schools, and sometimes you may be able to participate with them. And then my program, I did not participate in it, but they actually, one of the rotation options was a month in Peru to do women's health. And so that's a cool opportunity for a group of our students. And a lot more PA programs now are offering international rotations. I know with COVID, things are different, and who knows if or when that'll start back, but that may be something that you'd want to look for in a program. As far as my Kenya trip, I found out about that through a drug rep. It was actually sponsored. It was like a organization called Me to We, and they worked in conjunction with a pharmaceutical company who kind of sponsored the trip. So that was how I initially found out about it. It was at a conference, and like this is such a funny kind of bad story, but there's a table and this girl's like, "Do you want to go to Kenya for free?" And I was like, "That's a scam. No, but yes." And so I kind of took her information, like didn't think anything about it, but then I started talking to some other derm PAs and they're like, "No, this is a legit trip. Like it's awesome. You should do it." And so I applied thinking that I would never get chosen or whatever. And I applied in October for a trip that I thought was going to be in March. And then they emailed me, or like, "Well, we don't have a spot for you in March, but can you go in January?" And so I said yes and just went for it. I did not know anybody. Nobody was flying out of Atlanta with me. I just got on a plane, flew for 24 hours, got there, and tried to figure out who else was on this trip. So it was a crazy experience, but really, really cool. So just, Google searching and just trying to, I think, make connections is a great way to find those trips. And then like Facebook groups, talking to other students for sure. I don't know if that answered your question.
Yes, it did. Thank you so much.
Okay, so let's do a couple cases. This is one that I'm seeing a lot right now. So this patient is a 28-year-old female who comes in with kind of some red bumps around her cheeks and her nose and kind of on her chin. She states they're a little itchy sometimes, a little sensitive. She's tried different moisturizers. They don't seem to make any difference. She's tried some over-the-counter cortisone or like cortisone 10 with no change. She thought it was kind of making it better, but it wasn't really making a huge difference. So this has been going on now for a couple months, and she decided to come see what was happening. So with working in dermatology, we take a pretty focused history and physical exam. So nobody in my office has a stethoscope. I've never used a stethoscope in 6 years after I graduated PA school. So that's kind of strange, I think, for somebody working in medicine, but we don't need that typically. But we ask about kind of basic medical history and then a lot of very skin specific histories. So for this patient, she doesn't really have any other medical conditions. Her only medication is birth control pills that she's been on for a few years. She doesn't have any drug allergies, no personal or family history of skin cancer. She denies smoking or alcohol, and her only kind of recent travel was she went on a ski trip. She already had the rash before she went. She thinks it maybe got a little worse while she was there, but it cleared up when she got back. Other things that I would probably ask in this case would be about product use. So when she tells me that she's used moisturizers, I want to know more specifics. So what moisturizers have you used? What products? How long did you use them? Did they burn or sting? Did they make it better? Did they make it worse? Face wash, are you using any scrubs or any exfoliants? Any masks? Things that people may not think to tell you. You kind of have to dig a little deeper there, especially with face rashes on the face. I also ask about aerosols. So are you using any perfumes or any body sprays? Have you started using any Lysol or Febreze or other cleaning products that you don't normally use? Do you have any of those like room fragrance things that spray out? Do you use candles often? And kind of see if there's anything that could be perpetuating or causing this new onset of rash. Those would be kind of my main questions. I'll also ask, is there anything that you can tell triggers it, that you feel like makes it worse? Because sometimes people will have certain things they eat that affect their skin, or certain weather or the sun. So those are things we'll kind of dive into a little bit more. All right, so in physical exam, looking at her, she has some small pink pustules and papules with slight scale on her nasolabial folds in her perioral area. So this right here is your nasolabial fold. And so we're kind of looking to see what kind of bumps are there. A lot of times I'll ask, is this a good day, a bad day, or a regular day? Has it been worse than this? Has it been better than this? Just to get an idea of what we're looking at. And then looking at if she says, oh, this is a good day, then I want to know on a bad day, what does it look like? Do you have more scale? Is it more red? Do you have more bumps, bigger bumps? My patients feel like I ask them tons of questions just because we're trying to get as good of a picture of what's going on as possible. So this is kind of physical exam. And then we have our differential. So a differential diagnosis is basically a list of things you think it could be. And if you are in any type of medical program, you'll end up having to practice this and do this a lot with, trying to practice what you're learning. And with a differential, so especially when I started practicing, I tried not to necessarily have a differential in mind until I went in the room. I would say now, after 6 years, a lot of times, even just from the history, I have a little bit of an idea of what I think could be going on. Sometimes I walk in and I'm completely wrong because the history was way off or it just looks completely different. But like from the history, I could probably tell you what was going on before I went in the room. So differential would be number one, acne. Is this just breakouts? It could be. I would probably ask her also if she had changed birth control pills lately, if it was flaring around her cycle, if she had changed from a brand to a generic or a generic to a brand or changed pharmacies, because sometimes those hormonal changes can cause breakouts, especially in an adult female. We see it mostly on the chin and jawline. So that's a reasonable assumption. Rosacea. So, the fact that it flared a little bit on a ski trip, weather changes and sun can be big triggers for rosacea. So that may be a thought. Rosacea, you're going to have a little bit of bumps, redness, texture change. So that kind of makes sense. Seborrheic dermatitis, which is a fancy name for dandruff. You can have dandruff on your scalp, you can have dandruff on your face. The areas it typically likes are around the nose and right here, which is called the glabella. And we see that as the scale that just, no matter how much you moisturize, will not go away. And so that's very, very common. Also, flares around weather changes. Perioral dermatitis, which is a fancy name for bumps and irritation around the openings of the face. So that's around the mouth, around the nose, sometimes around the eyes as well. Could this be an infection? I would ask her, what's your job? Do you work in a healthcare setting? Have you had any sores in your nose? I'm going to be looking for yellow crusting to see if there is possibly a staph infection there. The nose is a very common place that harbors staph. I don't know if my microbiome class, we swabbed our noses and put it on a petri dish to see what grew. And I don't know if anyone else did that. But a lot of us grew out staph when we did that. So that's something I'd be looking for. And then a contact dermatitis. So asking about the products she's using, if anything has changed, and seeing if possibly this is something that's coming into contact with her skin that's making it more irritated. So those are things I'm kind of thinking about. Y'all can put your guess in the chat if you want to. I can't really see it, but go ahead and guess. And then I'll tell you, here's the answer though. So this would be perioral dermatitis, which that's a little bit of a trick question because perioral actually falls under rosacea. It's a subtype of rosacea. And it's very common. We do tend to see it a lot around fall and weather changes. Stress can be a trigger as well. Topical steroids are a trigger. So the fact that she was using cortisone 10 probably was not helping and may have been keeping it going and making it a little bit worse. Some of the treatments we use for this, so with patients, we can use either just topicals or we can use pills too. I usually talk to them about kind of both options, see what's best for that patient. But these are some of the topicals we'll use. These are all creams: metronidazole, ivermectin, clindamycin, and azelaic acid. And then sometimes we'll use oral antibiotics as well, out of the tetracycline class. So the main ones we use are doxycycline or minocycline. With treating this, I always treat for a minimum of 8 weeks. I don't know why I say 8 weeks and not 2 months. That's just what we say. So we always treat for 2 months. And then if they're still flaring, we may switch up what we're doing. But usually at that point, everyone's better. It's just that it can be chronic. It can come back. And so sometimes they do need to keep using topicals for a little bit if they feel like they're still flaring. All right, we can move on to case number 2. And this is one that I don't see quite as much, but sometimes. All right. So this patient is a 68-year-old male who comes in complaining of a brown spot on his forehead. If he's anything like the majority of my patients, his wife made him come in to see me. But it was noticed about 2 months ago. He thinks it might be getting bigger, might be getting darker, not really sure. He does not typically use sunscreen. He will occasionally use a hat, but not regularly. And he has not noticed any symptoms with this. So no itching, no pain, it's not flaking. He hasn't tried anything to make it better. He hasn't used any creams or done anything to it. So for his history, his only medical condition is high blood pressure. He's taking a medication called lisinopril for that, and he'll occasionally take Tylenol.
I'm not sure I understand.
Sorry, Siri thought I was talking to her. He has no known drug allergies. His dad had an unknown skin cancer. He does not smoke. He'll occasionally drink alcohol, and he has not traveled recently. Some other questions that I may ask him would be, what is your profession? What have you done for your job? If he's retired, what did you do? I'll ask about, dive in a little bit more to what kind of hat are you wearing? Is it a ball cap? Is it a visor? Is it a wide brim hat? Just to get a little bit more idea. Are you in the sun a lot? What kind of hobbies do you have? Have you been getting your skin checked? Has your skin ever been checked? Has anyone ever looked at this spot or said anything about it? Just asking more details about that spot. All right, so here is a picture. On physical exam, he has a 1 centimeter dark brown and tan irregular patch on his forehead. So when people come in with spots, there's a few things in particular that I'm looking for. I want all of their spots to be similar. So similar in size, shape, and color. One of the things that I'll explain to patients is when you're looking at your spots, they should all look like they were drawn with the same marker. If there's one that looks like it was drawn with a Sharpie or drawn with a different color marker, that could be weird. We talk about the ugly duckling. So if you can't find a twin, a spot that looks pretty identical, that is a red flag. I think most people have heard about the ABCDEs of spots. And we go by those some. So that's looking at if they're atypical, their borders, their color, elevation, and diameter. The problem with those criteria is that there are some people who every single one of their moles are larger than a pencil eraser. So for them, they can't really go by that parameter. And so that's why I like to use the kind of ugly duckling descriptor, I guess, better. And so it's nice when I do have like multiple patients in the room. If I have, a mom and dad or like a couple, sorry, mom and dad, or like a kid and a mom, because I can show them that, a mole that might be normal on me may not be normal on you and vice versa. So we all kind of have our own types of moles that we make, and we're looking more at comparing on yourself to figure out what's going to be atypical. And some people have a lot of moles, some people don't have a ton of moles. My differential for this would be, is this just a normal mole? So the real name for moles is nevus. And with looking at nevi, they can be either benign or normal or atypical or dysplastic. Those are the same thing. Moles that are dysplastic can be graded from mild, moderate, and severe. And after severe, we get into our melanoma spectrum. And so it may just be a mole. Could it be a lentigo, which is another name for a sunspot? So if you've ever heard your parents or seen like brown spots on your arms or face, and they talk about age spots or liver spots, those are typically lentigos or lentiginous. And so that's another option. Could it be a skin cancer? And with any pigmented spot, especially one that is new, changing, growing, that is definitely what we're concerned about, especially on someone older. So you can get new moles. The ones you have can change a little bit up until your 50s. After that, you really shouldn't be getting new, truly pigmented spots. There are other types of spots you can get, but not like a true mole. I actually did this case with, there was a group at a university in California that they have like a seminar, like a pre-PA seminar class. And so we went through this case. And so some of the other ones in our breakout session that they came up with that I thought were good differentials were a bug bite, which if you've ever had a bug bite like on your leg or arm and it turns kind of dark after it goes away, that's what we call post-inflammatory hyperpigmentation. So maybe he had something like that up there. Could it be hyperpigmentation due to medication? Which there are a good amount of medications that can cause hyperpigmentation either on their own or with photosensitivity. So if you're exposed to sunlight, you have some of that. Or could it be a bruise or a wound, which sounds kind of silly. You think like, oh, you would know if it was a bruise, but I can tell you, I see someone with a chief complaint that ends up being a bruise almost every single day. So it's not that far-fetched that it could, maybe it's just a bruise. So for diagnosis and treatment, with looking at this spot, with it being different and new, I'd probably look at it under what we call dermoscopy, which is just basically a magnifying glass with a light. And usually that'll show me more of that atypia, a little bit more up close and more of the coloring. So I would use that and look and then see if it looked normal. If it still looked atypical, or even if it didn't, I'd probably do a shave biopsy. Our pathologist, who we use something called dermatopathologist, so all they look at is skin, prefers that we do shaves on pigmented lesions. The problem with if we were to do a punch on that spot is that we don't have a punch big enough to get the full 1 centimeter. And so we're only taking a portion of that lesion. So if we missed the part that has melanoma cells in it, they may not be able to see that. So we would try to get as much of that lesion as we could, send it in, and this would come back as a malignant melanoma. So with melanomas, we have to treat them fairly aggressively just to make sure that all of those cells are gone. So even if my biopsy cleared the whole thing, technically, we would still go back and do further treatment on it. Treatment on melanomas is determined based on their depth. And then there are a couple other factors they look at to see kind of how quickly it's growing, called the mitotic rate, and whether it's more of an aggressive melanoma. So with this one, it would definitely need what we call a wide local excision. And depending on how thick it is, usually we'll take a margin of 0.5 centimeter to 2 centimeters at the minimum. And then if it is a deeper melanoma, it would need something called a sentinel lymph node biopsy, where they would go in and check some lymph nodes probably in the neck to see if it had started to spread. And then with anyone with melanoma, we're going to do some skin surveillance every 3 months for a very long time to make sure that there aren't any new spots. We're going to be checking their lymph nodes. and keeping a really close eye on their skin. All right, here is my info, and then I'll jump out of this and try to answer some questions. Okay.
One of the first questions that we have is, do you do any research regarding dermatology, or did any research?
No, so I've never been involved in any either lab or clinical research. My office doesn't do any trials or research, and then really for PA school, research isn't very important. And so it wasn't something that I got involved with at any point during my kind of PA journey.
Thank you. The next question is, how do you balance your work, family, and social life with like being a PA?
Yeah, it was hard, especially at the beginning, and I would say especially during PA school, it was very hard. And I think we throw around the term work-life balance a lot, but what I've kind of learned is that it will never be completely balanced. You'll always probably feel like you're doing better in one area than another. When I was working full-time after I had my daughter and I went back to work, I worked full-time for a year, and my husband was still in residency. And that year was really hard. I felt very burnout. I felt like I wasn't doing anything well. And so I really had to kind of make the decision that something had to give. I couldn't keep doing that. And so that's when I decided to go part-time. So I think you have to kind of constantly evaluate what you're doing and where you're committing your time and decide if you need to make any changes there. But for me, I have things that I am committed to that are pretty constant. And especially with my husband being, when he was in residency and now working as a hospitalist, I learned very early on that I could not plan my schedule around him, and I had to kind of do my own thing sometimes. So I have a group of girls that we do book club together and Bible study together, and those are my times like for adult like interaction without just talking to my 2-year-old all day. And also like my husband knows like that's time that I need, which has looked a little different with COVID, but I've still been able to connect with those girls. And so I make time for things like that. I'm definitely make that a priority for myself. And self-care, making sure that I'm, taking time to step away from clinical work and social media and all of the kind of responsibilities that I have. And I've also learned to be a lot better at asking for help. Luckily, my parents live very close by, and so they're able to help with my daughter when I'm, if I'm feeling overwhelmed or feel like I need to take some time away. So it's a constant struggle getting that balance. I have to have definitely my husband like remind me of like get off your phone or whatever. And so we can help each other with that.
Thank you. Actually, there's a question here. Any good book recommendations?
I actually just posted some on Instagram the other day because we have read so many good books. If you like thrillers, we just read The Silent Patient, and that was a good one. It's kind of dark, but it was pretty intense. And then our favorite, I would say, has been The Nightingale, which is like a World War II historical fiction. So, and if you want a medical book, since this is all medical people, anything by Atul Gawande, Dr. Atul Gawande, put it on your Christmas wish list. His 2 first books, one's called Complications, and the second one's called Better. They are like life-changing when it comes to your perspective about medicine. And just very, very eye-opening and enjoyable reads. So that'll be some of my recommendations.
Thank you. Next question is, how long did it take you to feel like you knew what you were doing after PA school?
That's a good question. So I would say it took me about 6 months to really start to feel comfortable. And that I wouldn't say that's completely after PA school. So the way I had my, I guess, path set up was I actually had my job, I guess, offer in April before I finished in August. So I was able to do my last 2 rotations at my job. So I started there in June. And so while I was still in school and then waiting on my license and board scores and all that, I was in a training period. So it definitely was intense. Like I said, we only got 2 weeks of derm in PA school, so it was a lot of self-learning. All of the physicians I've worked with have been amazing teachers, which I'm so thankful for. And so it was learning derm, it was learning billing, coding, the EMR system, learning procedures, and all of that for about 6 months. I was exhausted. I would get home. If I sat on the couch, I could not get up. Like I would just fall asleep because my brain was tired from learning everything. So I would come home and try to study and go to bed early. At about that 6-month mark, there were things I started to feel comfortable with. So I felt comfortable with treating acne and, starting to do more skin checks. And then over time, I got more comfortable with psoriasis and then more comfortable with peds patients. So it's kind of, been a slow process, but 6 months, I remember finally feeling like, all right, like I'm okay. I don't feel as overwhelmed and I can do this.
Thank you for that. Some of the questions are like, you've only had 2 weeks of dermatology in PA school. How did you know that dermatology was the path for you?
So I had a lot of experience before I got into PA school just because I had shadowed a lot. Like I probably had at least 100 hours of shadowing in derm because I'd gone pretty much once a week for an entire year of shadowing. So I think that is where I knew I was interested in it. And then once I got to rotations, I really liked everything, but my surgical rotation I was my favorite. And actually being in the OR and doing procedures, suturing. I was with a general surgeon who primarily does breast cancer cases. So we were doing tons of lumpectomies, mastectomies. He precepts a lot of PA students, and so he is a great teacher and also has very high standards for kind of choosing what he'll let you do. But we developed like a great relationship, and he was really helping me with suturing, and to the point where like during our mastectomies, like he'd be doing one side and I would be doing the other. And so it was a great experience. And he was the one who connected me with the dermatologist who was hiring because he knew her and had actually helped her hire the PA before me and kind of set us up and said this would be a good fit. So it was kind of relationships and timing and me knowing that it was something I was interested in.
Thank you. How do you deal with patients that aren't willing to be seen by a PA?
So I don't see them a ton. And I think part of that reason is because of maybe just how our office is set up. But there's a lot of steps before they get to me. So when they're scheduling, they're told they're seeing a PA, they get a text and an email reminder that they're seeing me, a PA. And then when they come into the office, up front, they tell them like, you're scheduled with Savanna, the PA. And then when the medical assistant brings them back, she tells them Savanna's going to come see you. So it's not really a surprise that they're seeing a PA. So if anyone has an issue with that, it usually is resolved before it ever gets to me. I've had maybe a couple, I think of like 2 this year who, didn't want to see, and that's fine. It depends on the day. If we're able to get them in to see the physician, we will. If not, they have the option of me seeing them and then following up with the physician at a different date or rescheduling. I'm not offended by that. It's totally fine, totally a patient preference. And so yeah, no skin off my back if they don't want to see me.
During PA school, what are PA students allowed to do during rotations?
It varies a ton. Like, definitely depends on who you're with and what your preceptor's like. I think I got very lucky with pretty much all of my rotations. And a lot of it is also, what's the word, like student driven. So if you are a proactive student and you are there to learn and you're asking to do things and telling them, I really want to be hands-on, I want to help, I want to do this, that's going to make a difference versus if you just show up and stand there. And so you have to be willing to kind of be a little bit vocal in that regard, and be willing to do anything. So if you get opportunities to draw blood or, do injections, do it. Like that skill and that opportunity is really important. But, I think on my rotations, I got to do a lot in surgery. On my emergency medicine rotation, I was the only student there, and my physician that I was with would, let me do a lot, let me go see patients. Most rotations, I would go see patients and then like report back to the physician, and then we'd go see them together. But he let me do a lot. And especially on that rotation, all of the providers let me do a lot. So they would come and get me if they had something interesting. So I got to reset broken bones, which I hate doing, but I did it. I got to put in a dislocated shoulder, suture up a chainsaw wound, take a fish hook out of somebody's ear. I got to do really cool stuff, but they knew I was willing to do that. Like, I wasn't just sitting around. So yeah, definitely being proactive helped.
Thank you. Someone in the chat asked, I heard that you're able to change your focus as a PA. Is this true? And could you switch from emergency medicine to dermatology, for example? And if so, how do you go about it?
Yeah, that's the nice thing about being a PA is you can switch, and it's very easy. It's as easy as just switching and getting a new job. So if I wanted to go work in emergency medicine or cardiology, I would just have to find someone to hire me and then train me, because I would need some time to go back over that and relearn a lot of things. But yeah, there's not really any certification or extra thing you have to do to be able to do that. I think that was the second part of that question, but I don't remember.
I think you answered it, yeah.
Oh, okay.
The next question is, do you recommend applying to many PA school, or is one enough?
So, I mean, one is a little bit risky unless there's, no like a reason you can't apply to more. The average number of PA schools that an accepted student applied to, that's been most recently reported, was 6. So, I mean, in that average, you're probably going to have some that are applying to 1 or 2, and then some that are applying to 10, 15, 20. I think if you can find some good programs that fit what you're looking for, that you also fit what they're looking for, that's going to be helpful to you in increasing your chances of getting in. So like, I applied to 4 programs my first cycle, not expecting to get in to any of them. But I interviewed and was accepted at 2 of them, even though I barely met some of the requirements.
Thank you. How did you keep yourself motivated through PA school?
It was PA school is very hard just because it's very fast. And like, for reference, so I was in class from 8 to 5 every day. We didn't really get much time off in between semesters. Like, my husband in med school, they only had class from 8 to 12 every day, so they had a lot more time to study and kind of, go over everything. So it was intense. During PA school, I really didn't see my friends outside of PA school, but I did meet 3 of my very best friends in my program. And so in having them, you know, we definitely helped each other and kept each other going, because we understood what each other was going through during that time. I lived at home for my first year before I got married. And then I lived with my husband. So that first year, I really didn't see him very much. My parents were a great support system. They made sure I was eating and fed and made sure that my laundry was done, which was really nice of them. They didn't have to do that. But having people around to support me, and then also like it goes by so fast that as soon as you have like a really hard week, it's done, and then you're moving on to something else, and you kind of have to be able to keep moving forward because it goes by so quickly.
Thank you. The next question is, what was the interviewing experience like for PA schools?
Oh gosh, PA school interviews are my thing I like to talk about. So for me, I enjoyed the interview process. Like I thought it was actually, I mean, it was super, I was nervous, 100% nervous, but it was also kind of fun. Like you're getting to meet people who are possibly going to be your classmates and in the same boat that you're in. So I really didn't view it as like a competition at that point or anything. But my interviews, I had traditional part. So I had one-on-one interviews and two-on-one interviews. I had a group interview where they were asking me and other applicants questions. I also had a group activity where we were having to solve a problem together. I had to write an essay at an interview. We also had one part of an interview where we had to, in front of all the other applicants and all the faculty, draw a question out of a fishbowl and stand up and answer it in a minute. It was like a Miss America contest, and it was so intimidating and scary. I don't remember what my question was. I completely blacked out, like no idea what I was asked. And so PA school interviews can be completely random. Sometimes you have to take a test at them. But yeah, they're doing some MMI, which is a little bit more of what med schools tend to do now. So there can be some like role playing or situational type questions or scenarios. But yeah, every school is definitely a little different when it comes to how they do their interviews.
Thank you. What do you think helped you get accepted into the PA program? Hands-on hours, shadowing hours? What do you think helped you stand out from other applicants?
So, and granted, when I applied, it was a long time ago, so I think it's only become more competitive. But my stats were pretty average for back then and now. And it really, I mean, if you have one area of your application that's a huge standout, like a super high GPA or a ton of hours, that's certainly helpful and really good, but it won't like counteract the rest of your application. I think for me overall, I just had a very well-rounded application. So I did have a lot of shadowing. I did not have a lot of patient care hours, and the 2 schools that rejected me, I didn't have enough hours for them, and I wouldn't have had enough by the time I started. The other 2 that I was accepted at, one had a minimum that I met, and the other one just said a recommended patient care hours, but didn't have a number. So technically I met those requirements. And then like my GPAs were average. I think they're around like a 3.5 for overall in science. I had a lot of volunteer and leadership experience. So I was really involved right from the beginning of college with my campus ministry called Wesley Foundation. And so I would, like I was in small groups, I was doing volunteering with them, with like mentoring students in the community. I was leading small groups, doing mission trips. And so I think that helped just because it really showed commitment throughout all 4 years of college. And it wasn't like I was just cramming and volunteering at the end. And the reason I say all of that is because at one of my interviews, the interviewer, who was very nice, and she did not have to say this, but she said, you know, for how old you are and still being an undergrad, you've done a lot. And so like to have someone recognize that meant a lot, because I'd been at an interview before then that was incredibly intimidating and they were not super nice. And so it was really nice to have someone kind of say, who I felt was important, say like, no, like we recognize that your application is impressive. When I'm sitting next to someone who has better grades and has way more hours, and I don't feel like I deserve a spot at that interview. So I think just realizing that, you know, everyone has different strengths, but trying to be as well-rounded as possible on your application is important.
Thank you. The next question is, what is the best way to keep or document your PCE and HCE?
So number one, in an area that will not get deleted. So I would say not just like a document on your computer, but ideally on your Google Drive, or like a note on your phone is probably okay. Still probably maybe a little bit risky unless you're backing up your phone often. If you go to the paplatform.com/downloads, we actually have an Excel document that's set up with, for PA school, exactly how you'll have to enter it. So the way you enter it, it's actually kind of weird. You have to do hours per week and then come up with total number of hours and have certain information for that experience. So we've made a document that you can use to fill all that out and kind of keep track of it.
Thank you. The next question is, did you ever feel intimidated going into PA school up against other applicants?
Kind of. I mean, yes, to a degree. I think in general, and so like when I was in my science classes, a lot of people were pre-med, like everybody was pre-med. And so there were definitely people that I felt like were super competitive, even at an undergrad level, which was always weird to me. Like we're all, I don't know, I just feel like there's enough room for everybody. And so when I was applying, there really weren't a ton of us that were pre-PA. I tend to be a pretty competitive person, so I would get a little defensive when I heard other people be like, I'm pre-PA too. I was like, oh, I don't want to help you. But I also very quickly realized like that's not a good attitude. Like we can all help each other. And so I mean, I would say it was definitely more of like a camaraderie versus a competition. And then at the interviews, I mean, you do realize like you're up against these people, but it just never really felt like that. Like I never felt like I shouldn't talk to them or get to know them because they're my competition. Like, I don't know. I feel like there was room enough for all of us at that point of getting the interview.
Thank you. The next question is, could you repeat your hours and what does a typical full-time day look like compared to a part-time day?
Oh, like my job? Is that what you're talking
Yes.
about? Okay. So now I work Mondays and Tuesdays from like 8 to 5. At my previous job, I worked Monday through Thursday from 8 to 5, and then a half day on Fridays. And then I pretty much always have an hour break for lunch.
Thank you. Can you talk about the difference between an MD and PA if you can?
Yeah, so like the actual job?
Yes.
Okay. So there's definitely some differences, and a lot of it's going to be kind of state dependent on what you're able to do as a PA, and also, you know, depending on where you are. And so, you know, if you're a surgical PA, you're probably not going to do everything the doctor does. Being in derm, we do look very similar, and that's just how my practice is set up with the types of patients we're all seeing. But ultimately, as a doctor, the path to get there is going to be different. You're going to make more money as a doctor. You're, as a PA, going to have some type of relationship with a physician. So, you know, part of what makes the PA profession is that we have a collaborating physician. That doesn't always mean that someone is going in every single room with you, but in some cases, there's going to be more, you're going to work closer together and have more collaboration versus something like my job. And I think that's one of the unique things about being a PA is that even though we have, I don't know, the same title, we all look very different. I have 3 really good friends who all do emergency medicine, and their jobs are all completely different, and their level of autonomy and what they actually do and what it looks like is very different. So it's kind of, you can, if there's something you're looking for, you would be able to find that as a PA. But like, as far as being a doctor, like you're going to have the final say. You might be supervising a PA. My husband now has PAs that he works with. So yeah, I mean, there's definitely some differences, but it's really going to depend on where you're at and what you're doing. So, and yeah, that'd be fine.
Okay. If anyone wants to ask their questions directly, you can use the raise your hand button. It's under participants, I think, and then you could just raise your hand. And for the next question, do PA school require your volunteer hours to be medical related, or any volunteer hours is good?
They definitely don't have to be medically related. And I mean, they can be, but I recommend doing something that you're actually interested in. Because when it comes time for the interview, if it's something that you did just to get hours, it's probably going to come off as not being that genuine, that you don't really care about it as much. But if it's something that you were actually really interested in and really cared about, they'll be able to tell.
Can you talk about the stress load about being a PA and how do you handle it?
Oh gosh. So it can be stressful. And I think being in derm and being really quick, there are days where I'll get behind, and I don't like that. I like to respect my patient's time. I don't like to make them wait a very long time. So that can stress me out. I work very closely with my medical assistants. So I pretty much always have a medical assistant with me. And I think in both offices I've worked in, you have to have teamwork to make things go smoothly. So we keep each other on track. We keep each other kind of grounded. If I am starting to get negative, they'll kind of, give me a reminder, like, we got this, no worries, like, it's fine, we'll get back on track. So we encourage each other to make sure that we're, not getting too negative. And we have what we call train wreck days, where it's just every patient is complicated. Something happens that we didn't expect, whatever. And that happens. Those days, I go home, I'm not going to cook. I'm going to get takeout. I'm going to sit on the couch and watch a movie with my daughter. I'm not going to try to clean the house. Like, I'm going to give myself a little bit of grace there too, to just, finish out that day and start a new one tomorrow, and kind of roll with it.
Actually, it kind of ties in with this. What other staff are you working with for an average appointment? Do you have your own MA helping you with your patient, or is it a general shared front office?
So a little bit of both, honestly. So at my old office, I had one dedicated MA, and she's actually in PA school now. We left at the same time, and she started school. And she's one of my best friends. But at my office now, so there's 3 providers, and we have 4 MAs. So we all have a dedicated one, and then we kind of have a float who will, but they all help each other too. But like, if somebody's in a room and a patient's there waiting, they'll go ahead and room that patient. Or if somebody needs to check messages, they'll go ahead and check messages. We have a dedicated scheduler. We have 2 people in billing, and then 2 people up front at check-in and 1 at checkout, and then our office manager. So we're all, working together to make sure that everything runs smoothly. But yeah, me and the medical assistant, all of them, we work really closely. Like, I've worked with every single one. It just depends on the day. If we need to make adjustments or whatever.
The next question is, what do you recommend for someone who has a low GPA and wants to apply to PA school?
I see people get in all the time with low GPAs, or what they would consider low. My rule of thumb is if you meet the minimum requirements for a program, go ahead and apply, and look at those weaknesses and keep working on them. So if you know that GPA is your issue, take more classes, maybe even look at doing a master's program, look at classes that you maybe didn't do well in. If they were prereq classes, repeat them. Make sure the other parts of your application are strong. But just having a low GPA shouldn't make you feel like you can't ever get in. So if you can, like if you Google the PA platform low GPA, we've had tons of posts that we've done with applicants who had low GPAs, and interviews, and we do something called accepted posts where we have people list out their stats, that you can see and kind of get an idea of realistically, people who have been accepted to PA school and what that looked like.
The next question is, how often can someone do a chemical peel in a year?
So it depends on which ones. The ones we do can be every 3 to 4 weeks, but there's like a million different peel types and lines and all kinds of stuff.
Thank you. My next question is, did you ever deal with like imposter syndrome, and how did you handle it?
I think so. I mean, there are definitely, I think especially when I first started, there were days where I didn't feel like I'm like, why am I don't deserve this. Like, I'm not ready or whatever. Especially on rotations too, where I really was like faking it till you make it type thing, but you obviously have supervision and somebody there with you. But I think everyone feels that probably in every area of life at times. I think anytime, even now, like giving talks, I'm like, oh my gosh, why do they want me to talk? So I think it's just, you've got to realize that you have something to share and that you are probably more well equipped than you think. And that's what I think, even on rotations, I remember them asking questions and I would like feel like I knew the answer, but I was too scared to say it. So I'd be like, oh, I don't know. And then I would have been right if I just had said it. So I think we just have to always work on our confidence in what we know, and being willing to be wrong too, and accept that and learn from it.
Thank you. Based on your experience, how much autonomy do you have as a derm PA versus PAs in other specialties?
So I've never worked in anything else. So all I can really compare to is like some colleagues. I have a lot of autonomy. One of my friends worked in vascular surgery. And she also had a lot of autonomy, but like her surgical role was different. She would basically start a case. Her physician would come in to do his part. While he was doing that, she would go start another case. He would go and do his part on that one, and she would go close the first one. And so like they kind of switched off, and she would basically start and finish cases, but she wasn't doing like the main part of the surgery. So that was a little different. Some of my friends in the ER, like there's one that she's really autonomous, but in her ER, the PAs only see like the lower acuity cases typically, unless they are slammed or something weird happens. But ultimately, like she's really on her own unless she needs help. Versus I have another PA friend in the ER, and she said for her, like both her and the physician basically staff a case. But it's more like she'll go see them, get them started with imaging or test or whatever, get the process going, and then check in with the physician and kind of be like, this is what I'm doing, this is what I'm thinking. And then if he feels like he needs to he or she needs to step in, they will. But they're essentially managing it together. So I mean, and part of that's your preference, like depending on what you want to do, you can probably find different roles like that.
Thank you. Did you ever feel like doctors are throwing the PAs their workload?
Um, I don't know that I've ever felt like that. I've always worked in offices that have been very respectful, I think, towards PAs. So like if a patient, let's say it's like 3:30 and a patient calls or the physician's running behind, they're never like, oh, you need to do this. They're like, hey, could you see so-and-so that just called, or could you see this patient, we're running really behind? And I'm like, yeah, that's fine. Usually it's not an issue at all. But yeah, I've never felt like it was a situation where they're like, you have to do this. And I think in general, like in most of medicine, there is a lot of mutual respect between all healthcare providers, um, more so than people think. So yeah, I've never personally felt that in any of my jobs.
Thank you. How do you know how deep to go when you're excising the melanoma?
Well, as far as depth, you always go down to muscle. So we take the layers of the skin. So epidermis, dermis, subcutaneous fat. We go all the way down to muscle. And then the diameter around it will change based on the depth and aggressive factors of the melanoma.
Sorry. Could you share a little bit about your own skincare routine because your skin is good? And did you ever feel like you needed to do cosmetic procedures to keep yourself young since you're in the dermatology field?
So I enjoy doing cosmetic procedures. The only thing I've done is Botox and chemical peels, which I do fairly regularly since I started working in dermatology. So I do those things regularly. I have, if you like on my Instagram, I've linked a lot of what I use or what I recommend. I typically use Revision skincare products. And those are ones we've carried in both of my offices, but lots of sunscreen, being fairly consistent with washing my face, moisturizing, using retinols, vitamin C. Those are kind of my mainstays. I put a lot of cream on my face. My husband is always like, do you really need all those bottles? So I admit that I use a lot of stuff, but I have learned and seen the benefits over time. Now, that being said, I still get breakouts 100%. Like I do not have perfect skin at all. So just want to make sure everyone realizes that.
Thank you. What was it like being pregnant while changing your schedule around? Did you ever feel like your work was flexible with your needs?
So that was hard. So being like while I was pregnant, I worked right up until I delivered. I was induced at 40 weeks and I worked on Friday, was induced on Monday. And so I took 11 weeks off and then I came back and I did start a little bit slow for the first couple weeks and worked back up to my full schedule. I had a lot of support. Like my mother-in-law was keeping my daughter, and we had a nanny for a couple of days as well, because my mother-in-law wanted to keep her. So we had help with childcare. I did, after I had her, go back down to 4 days a week, which was nice to have a little bit more time. But even after that year and wanting to go part-time, my office actually, the reason I switched was because they weren't able to accommodate that. They just at the time, what they needed wasn't what I needed, with hours and schedule. And so that's why I ultimately had to leave, which I loved that office. I loved everyone I worked with. So it was really hard to make that decision and really sad. But I will say my new office is amazing and like super family friendly. My physician she has 4 kids and she does not believe in ever like missing an event. I've actually had to bring my daughter to work with me a couple times. So she'll come hang out for an hour or two and they love her. My doctor brings her presents. Like it's a very family-friendly office. My physician actually brings her dogs to work with her. And so we have a really great office environment that is very supportive of having a family and having kids.
Thank you. How do you think your work life / schooling compares to that of your husband's?
So I think in med school, you definitely go into things more in depth, but they give you a little bit more time to absorb it. The other big difference in medical school and PA school is I was required to be in class and the med students were not. So they were able to watch lectures at home or watch them later on their own schedule, but they didn't have to necessarily go to class. So that was very different because we had to be there no matter what. So that was kind of strange. I think, PA school, you definitely touch on a lot of what they learn clinically in medicine, or in medical school, but you're not going to go as in depth into, they did a lot of review of biochem, of microbiome, of pathology, whereas we really did anatomy and physiology and then jumped right into the medicine part of things. So our schedules, like for me, I was basically 4 semesters of classroom with just a couple of days in between, a couple weeks at Christmas. And then a full year, 3 semesters of rotations. For my husband, they did 2 semesters of class and then he got the summer off, which he did research. A lot of med students need research for residency. And then another year, 2 semesters in the classroom, and those are all those like 8 to 12 classes. And then the first year of rotations in med school is like a full year of a bunch of rotations. The second year was a lot more laid back. It was a lot of time off for residency interviews, a lot of electives, and what they call sub-Is, which are like getting ready for residency, where you do whatever your specialty is. And so that year was a lot less stressful. But yeah, that was probably the most intense year was the first year of rotations for him. And then the other difference in PA school and med school is the testing. So PA school, you just take boards at the end. In med school, you take tests throughout, which they've changed recently to just be pass fail. There used to be scores, and those scores used to be very, very important for kind of where you'd end up doing residency and what specialty you could do. But he had a test after his first 2 years of medical school and then after his 3rd year as well.
Thank you. Do you know if PA schools take into account how much you work? Because like working full time is hard while like trying to get your undergraduate degree, and sometimes you can't finish your like shadowing hours with it.
I mean, I think they definitely look at that. And then I also think that's why like med school requirements are a lot more standardized than PA school ones. Because there are PA schools that focus more on having experience and then PA schools that would focus more on grades. So you kind of have to look at those things when you're considering programs and look at your own application and where you're at with things. And that's why there's no problem with taking a gap year. Like to get your experience, it's better to take that year and get more experience versus trying to cram it all in and sacrificing your grades just to try to apply earlier. Because in the grand scheme of things, an extra year or 2 is not going to be a big deal.
Thank you. There are virtual shadowing opportunities online like this one, but how do you go about getting shadowing hours with PAs or like just in general?
Everybody, yeah, it's hard right now. It is, I think with COVID, it's really hard right now. But the one thing I'd say about that is like keep looking for opportunities. Don't stop looking for them because things are changing constantly. But when you're looking for shadowing, the first place to look is your personal contacts, even if it's like a distant contact. So some of my shadowing came from like my dad's friend who I didn't know, who worked in administration at a hospital, who knew they had a PA. and was able to connect me with the people who knew her. So you can, even if it's like a neighbor's friend or a neighbor's cousin or whatever, any connection you have, try to take advantage of it, even if it's a provider that you see. The worst thing that'll happen is somebody says no. So first use those personal connections, because if you have someone who knows you or can kind of vouch for you, they're going to be more likely to let you come in and see their patients with them. If you do have to do like cold calling, which is what I had to do in Athens because I did not know anybody. And I went through the whole phone book and called every medical office in Athens. My technique was I would ask if they had a PA. If they did, I would ask to speak with the office manager. If you just leave a message up front, like usually it may not get to where it needs to go. So I would ask to speak with the office manager. Usually that meant leaving a message or getting their email address. And then I would, follow up or leave a message about, I'm interested in becoming a PA, blah, blah, blah. Are there any shadowing opportunities with your PA? Out of that, that's how I got that derm PA opportunity. Only one other office contacted me back, and it was an ortho office. And they wanted a resume, which I sent, and then I just never heard back. But my resume really didn't have anything on it. So using that. And then I think one thing you could do right now is trying to connect with PAs either through LinkedIn or social media, and not necessarily asking to shadow, but just asking to have a conversation, and making that connection with them. So being able to say like, hey, I would love to talk to you on the phone or on Zoom, or take you to coffee or to lunch and just hear about how you became a PA, what your job looks like. Because if you can create that relationship and personal connection, again, they're more likely to be like, okay, you're not a psycho, you can come shadow with me. And so it is hard to let random people come into the office if you don't know anything about them. So those are some techniques to try to kind of make some of those connections.
How was your PA school experience in your specific program, your specific PA school?
I thought my PA school experience at Augusta University was great. It's a state school, so the tuition was a lot less than a private school. But also being a state school, they get really good funding from the state. So we had like a full surgical suite that actually the med students would come use, because our director was like really good at getting grants for things. So we had this huge surgical suite where we got to practice things. We had great simulation labs. We had a full cadaver lab. Lots of just kind of resources throughout my program that I felt like were pretty unique and helped us to be hands-on. My program had 44 students. I think that was a good size. I felt like I at least knew everybody some. And it wasn't, I'm sure there's a lot bigger programs, they're smaller. But for me, that was a good size. And, I enjoyed our faculty. I definitely enjoyed making friends who I still talk to almost every day. So, yeah, I'd recommend it if anyone's interested in Augusta University.
There are actually people here that are interested in it. That's why I asked. For my last question, do you have any last minute advice to pre-PA students and pre-health students in general?
I think definitely shadowing when you can. If you're unsure, if you're unsure of what you want to do, shadowing can help a lot. And then one thing, just depending on where you're at in the process, like researching programs early and looking at what they require, what they're wanting, so that you can focus on that early versus kind of going into it blindly, or just kind of assuming everyone has the same requirements, but really making a list and checking up a lot. So, checking in on those requirements because they can change each year. And also, find colleagues and support near you. Like if your school has a pre-PA or pre-health program, or club, get involved, and kind of have people around you that y'all can support each other, because it a hard, stressful, confusing process. And I think things like what y'all are doing and social media have definitely helped. But having those people you can really, powwow with in real life and in general is very helpful.
Great. Thank you so much, Savanna. That was super informative, and I'm sure our students have some great notes for our post-shadowing assessment. So students, at this time, I would love to walk you through how you can get your verified shadowing hours. Don't forget to rate and comment on the talk. You have a little comment box on our website. If you scroll all the way down to the bottom of Savanna Perry's page on our website, you can find that. Let us know if any part of today's presentation resonated with you, or if you found any key points specifically helpful for your experiences for right now. My next announcement is please help us raise money. We don't expect you guys to be sending us money. I know we are all students and we're all just trying to get through school. And so I actually just encourage you guys to share this. So please scan the QR code. I invite all of you to do this who've attended today. Pull out your phone and go ahead and scan that QR code. This will bring you to a page where you can join our fundraising team. And as a member of our fundraising team, you can send out donor requests. And so right now, we have a lot of students joining, which is super awesome, and we are excited to continue growing our program. However, with all of the new students, we do have to update a lot of our platforms. And so our emailing list, our website, etc., are starting to add up. So just to keep this program afloat and to keep shadowing free for all students everywhere, please consider, if not donating, sharing with at least 10 people. It's greatly appreciated. You can also get volunteer hours for this. And if you have more questions about that, I'll talk about it in a moment. So we are taking applications to become a team member. So pre-health shadowing is a student-based, student-led team. Currently, we have about 20 students on our team. And we understand that you guys are all pre-health students, trying to get through school, trying to start your applications and such. So if you don't feel like you have enough time right now to commit to being a team member, we also provide volunteer opportunities. And so if you join the fundraising team and start sending out requests, you're eligible to get volunteer hours for this. So to get those volunteer hours, you're gonna go to our website and click volunteer and sign up to become a volunteer. At that point, within a week, you'll receive an email with more information of how to log in your hours. Our spotlight student of the session today is Ifoma G. Thank you so much. Be sure to continue sharing our Instagram stories. Every time we have a new speaker, we post it. Be sure to repost so that we can have every pre-health student on this planet have the opportunity to join our program. That's ultimately our goal, is to create opportunities and ensure that everyone is able to participate if they would like to. I have a challenge for you all today, and that is to head over to our Instagram page and to comment Savanna Perry's last name, letter by letter, on her post. If you're able to do this without interruption, you may be eligible to be picked for the Spotlight Student of the Session. And so good luck with this, because it's really difficult. Our next shadowing session is tomorrow, November 20th at 11 a.m. Pacific Standard Time. We will be shadowing a MD who specializes in regenerative medicine, I believe. So thank you for coming to our virtual shadowing session. Raph, did you want to jump in there?
Oh yeah, it's physical medicine and rehabilitation, sports medicine.
Great, thank you. So sports medicine. If you guys would like to take the post-shadowing assessment, this is how to do so. You are going to go to Savanna Perry's speaker page on our profile. And this will have her picture next to it with a little bio. To the right of her picture, you will see the free Take This Course button. Once you get into there, you're going to have 15 minutes to take the quiz. You must pass with a score of 70% or higher to be eligible to receive your certificate. Upon doing so, you must go back to the original page where you clicked free take this course, and you'll see a finish course button. Once you click this finish course button, you'll be able to receive your certificate and download it immediately. You can also find your certificate at all times in your profile under the certificates tab. Please be sure that you click finish course, because if you don't click finish course, you will not receive your certificate. If you guys have any questions or experience any issues, feel free to reach out to us at info@prehealthshadowing.com. And that concludes our 17th virtual shadowing session. Thank you all for joining us today, and have a beautiful Thursday. Bye-bye.